Thank you all for joining us this evening. I'm Molly Altobelli. I'm a physician here at Allegro, and we are going to be talking about puberty this evening. So just a little bit about myself. I joined Allegro 3 years ago now. Before that, I was in private practice in Houston, Texas, and been in practice, gosh, for about 12 years now. So I have guided many uh, tweens and teens through the puberty process. As a disclaimer, I don't personally have a daughter. I do have a wonderful 11-year-old son. And of course, I have many of your wonderful daughters as patients. To update that photo, he's getting older. All right, so a little overview about what we're going to talk about this evening. First, we're going to talk about how to have this puberty talk. Then we're going to go over some basic puberty facts. We're going to go over, once you know about puberty, how to feel confident and prepared for it when it happens. And then finally, at the end, we will have some questions and conversation. So part one, let's talk about how to talk about puberty. So here's our first polling question. This is for everyone, adults and girls too. What was your experience like learning about puberty? Oh, I think that is, yeah, a different polling question.
Sorry about that.
Preview of later.
Here we
So
go.
your options are: no one told me anything. There we go. It was embarrassing and or scary and or confusing. It was great. I felt confident and prepared afterwards. Or this is my first time learning about puberty. We'll take a few seconds to let everyone get their answers in.
Looks like we're having a bit of a delay with the polls here, so we'll just give everyone another minute here.
Okay, sounds good. Okay. So for those of you that were able to answer a handful there, I am sorry to hear that, for the majority of you, it was embarrassing, scary, or confusing. I'm glad at least somebody out there had a positive experience. I hope that by the end of this talk this evening that more of us will be in the category of I felt confident and prepared afterwards. All right. So let's talk about how we can have this conversation. So the first part is just go over some ground rules with your daughter so that it feels safe, so that she feels like it's a safe space to talk about things that can be embarrassing and awkward, but only if we make it so, right? So we want to make sure that she knows that you're not going to tell anybody what you talked about, that you are happy to answer any questions she has. You're not going to judge her. If she asks you a question about something, you're not going to assume it means she's doing anything or not doing anything. So try to be as confidential but open with her as you can. When it's time to have this talk, you want to see what she knows about already. So, you may find out that your daughter knows a lot about puberty already from friends or older sisters. And really, she just has some specific questions for you that, she's burning to know the answers to. She may know absolutely nothing. And then, okay, we need to start with, the very basics. It's really important to ask what your daughter wants to know about puberty. You may have this whole wonderful concept of everything you think is important to teach her, but if you launch into it and she's really just waiting to hear about the one thing she cares about, she may not hear any of the beautifully worded, pep talk that you're giving her if she's just waiting and waiting to hear what she wants to hear. So make sure you're not going over ground that she either already knows or doesn't care about yet. So find out what she wants to know, and then you can decide, okay, we covered what she already knows. I know what she wants to know. Here's what I also think it's important for you to know. And you can put that in as well, right? And then the final part about talking with your daughter is make sure that you're using correct terminology. You both want to be on the same page. You don't want to avoid any confusion. And so that means we all have to get a little bit more comfortable with using words that depending on our upbringing and our own experience, we may still not be comfortable saying, but we all need to learn how to be comfortable saying body parts like vagina, because there's just no way to talk about it and know that you're both talking about the same thing if you're using euphemisms and slang. And so practice it, saying all these funny words out loud right now, even if you haven't, you got to practice being able to say penis without giggling, or testes or labia, uterus, ovaries. All of those are going to be important in your conversation. So use the correct terminology. If you need to practice beforehand for your own sake, go ahead and do it. But you'll have a much more productive conversation if you can talk about things with their correct medical term. All right, so part 2, puberty. Here comes some facts about puberty. I have a picture of a train up because we often use the analogy that puberty is like a train. It comes when it comes. There's nothing you can do to make the train arrive at a different time. And once it does come, you got to get on board. So here is question 2. This one's just for the girls. Are you looking forward to puberty? Yes, no, or I'm not sure. May not be something you've thought about, whether you should look forward to it or not. Okay, so some yes, some a little bit of no, and some I'm not sure. Okay, good. So when it comes to puberty, the normal time for puberty to arrive, so the normal train departure time, is anywhere from between ages 8 to 14. So that's a pretty broad range, right? That means some girls will start puberty when they're in elementary school, and some girls will not even start puberty till they're in high school. It's really important to know that any time in there is normal. The average time from the start of puberty to the end takes about 4 to 5 years. So that's a long process. So again, that might be spanning from middle school all the way into high school, or some, variation thereof. If you are at all worried that maybe, puberty is starting early for your daughter before it should be, or if it hasn't started at all, then that's a good time to check in with your pediatrician. Okay, but I'm warning you, the next slide coming up has some sort of cartoon drawings of body parts, naked body parts in the stages of puberty. So don't want anybody to be taken aback. All right, so we divide puberty into 5 stages. Stage 1 is basically like a little kid's body, and stage 5 is a fully mature woman's body. And it goes through a progression of development of the breasts and the pubic hair in between. So the first sign of puberty for most girls is going to be breast bud development, and that can be one side or both sides at the same time. It may or may not come with a little bit of tenderness as that tissue grows. All of that is very normal. For some girls, the first sign will actually be armpit hair or a little bit of pubic hair. Stage 2 of puberty is what I like to think of as the shopping stage, because you're going to be needing to get training bras, perhaps, needing to get new clothes because your daughter is growing so fast. This is when the most rapid period of growth happens, is during early puberty. She's gaining a lot of height, growing out of those shoes and pants that you just bought her. The question that people really want to know a lot of the time is, okay, so once puberty starts, how long do I have before I get my first period? For most girls, that is going to be somewhere around 2 to 2.5 years. So periods usually happen around stage 3 to 4 of puberty. And so it's after the breasts have developed, after the pubic hair has gotten thicker and longer, and you're starting to have a slightly more closer to adult female shape. So, many girls will have their first period around the time their mothers or older sisters did, but not all of them. It's the more reliable indicator is, when did you first start, and add about 2.5 years to that. Okay, this is what everybody always wants to know about when it comes to puberty in girls, of course, is the periods. So this is a very simplified, sort of cartoonish drawing of a uterus. So this is the uterus right here. These are the fallopian tubes. These are the ovaries. You don't really need to know any of that to understand periods in a very simple way. It's just on here by way of somewhat of an explanation. Basically, what happens during a period is that the lining of the uterus starts to grow. It thickens, it develops this nutrient-rich, blood-rich tissue that then, once it grows slowly over the period of a few weeks, and then that tissue starts to dissolve. It disintegrates and it passes out through the vagina as blood. So there is blood involved in periods, but the key here is it does not hurt. It does not hurt the way bleeding in other parts of your life hurts. You may feel a little bit of cramping with periods. You may feel like a squeezing or a mild aching in your lower stomach or pelvis, but that's about the extent of the pain. If it is really, really painful when you get your period, then again, that's something you should talk to your doctor about. But there are so many more other aspects of puberty than just our periods. There are changes that happen to our skin, to our bones, to our hair. So skin changes as we go through puberty. Starts to produce more oil from our sebaceous glands, which when mixed with bacteria in our skin can cause acne. That's the pimples that people often dread during puberty. Sometimes for some women, their skin gets a lot drier instead of more oily. So all kinds of changes can happen. Our bones are growing and laying down a lot of important foundational matrix for future bone health. So it's a really important time to make sure that you are getting plenty of calcium and vitamin D in your diet. Your hair is changing. It might get coarser, thicker. For some girls, it actually gets thinner. There's all kinds of different changes your hair can go through. And of course, you may have hair on other parts of your body that you didn't before, on your armpits or between your legs. All of that is normal. But it is something we need to remember is that we got to take care of our whole body, and taking care of our skin, bones, hair, and everything inside involves getting really good nutrition so that all those changes happen in a healthy way, getting enough sleep, drinking enough water. We've got to remember to take care of ourselves, take care of our bodies. And then there's the emotional aspect of puberty. There's all the feels. So during puberty, girls' brains are just suddenly exposed to this bath of estrogen that they weren't before, and it really makes an impact on the brain. And they can go from being happy and excited to sad to tearful to angry, all within the space of about 2 minutes, as anyone who's lived with a tween or teen knows. And so there are changes going on the inside that are just the result of the things that are happening in our body, but are expressed as changes in behavior. So a quick look at what's going on in the brain during puberty. So highlighting two parts here, the prefrontal cortex, and then this funny egg-shaped thing in the middle called the amygdala. The amygdala is the part of the brain that's responsible for our emotional development. The prefrontal cortex is the part of our brain that's involved in thinking, planning, consequences, and impulse control. So guess which one is growing rapidly during puberty and which one is not fully developed? That's right. So your prefrontal cortex that's responsible for long-term planning and making good decisions just isn't fully there yet. It's getting there. This is an important time for it to be growing and improving. But what's really driving the brain here is the emotional side, and it's important for us to recognize that. All right. Question 3 for the girls. Which aspect of puberty are you curious or concerned about? Is that breasts, periods, body hair, growing taller, or something other? I always like asking this question because that's everybody has something that there's something different that they're focused on. Yeah, so just very typical. It's all over the place. In general, we tend to be a little bit more anxious about or curious about periods, but there's other aspects that we think about too. So thank you all for responding. And for those of you who, I hope we cover everything in this lecture. If we don't get to something that you're curious or concerned about at the end, please make sure to put a question in the chat. All right, part 3, feeling ready. So every girl should feel confident and prepared for puberty. All right, so the first step to feeling confident and prepared is know what you're dealing with, right? Arm yourself with knowledge. One of the things you can do is come to this talk. So you've done something already, which is wonderful. Parents, you're going to have many talks with your daughter about puberty. It's not just a one and done kind of deal. The talk you have with your daughter before she starts puberty, when she's, in elementary school, is going to be very basic and different than a talk you might have a few years later, as she's getting into middle school or high school. There's a lot of great books out there on puberty now, which is so wonderful. It's so wonderful that we're talking about it and it's socially acceptable to talk about it and read about it in ways that weren't the case before and are still not the case in some cultures. So I've got some book recommendations at the end, that I'll let you know about. And then it always helps to be prepared, right? Make a period kit. So this is just can be a cute little bag that you fill with some pads and panty liners, maybe an extra pair of underwear, Ziploc bags. And then I have this photo of this lovely young woman here because she's got a flannel tied around her waist. And so everybody always worries about leaks, about being caught unprepared when they have a period and could it stain my clothes? Gosh, it happens so rarely, but it's something we worry about. So why not just have a backup plan in case? And if you keep a jacket or cardigan, or this being the Pacific Northwest, a flannel shirt with you in your backpack, then you'll always have something you can tie around your waist in case you accidentally do get a stain. And then last of all, but equally important, just prepare something fun to celebrate when you do get your period, because it is something we should celebrate. It means your body is healthy, it's working the way it's supposed to, and that you're growing up and getting ready to become a woman. And it's something we should celebrate. And every family will have their own way that handles that best, whether it's just a girls' night out or a family meal, or something you do, privately, mom or dad and daughter when that day happens. As I was driving over here to do this talk tonight, Girls Just Want to Have Fun came on the radio, and I thought, oh, that's a sign. We should always remember that, through all this seriousness and importance, let's remember to have some fun with this too. All right, so when it comes to educating yourselves about puberty, there's some books out there I just wanted to mention. I really like The Care and Keeping of You. That is for a bit better for younger girls, sort of the tween age. For people that really want the nuts and bolts and details about periods, the Hello Flow Guide Period is a good one. I also really like Celebrate Your Body. It has a lovely, body positive message, and really explores and celebrates all the different variations of experiencing puberty that you can go through. And it's a very positive book. I also have recently added What's Happening to Ellie. Someone asked me a few years ago about books for girls on the spectrum, and it's a great question because the experience of puberty for girls who are on the autism spectrum is different. And so this What's Happening to Ellie is one of those books that's a nice one targeted toward those girls. There's some other ones out there too. In terms of good websites, I like healthychildren.org. They are powered by the American Academy of Pediatrics, and they have all kinds of articles on different facets of puberty that you can explore, and they're a nice, reliable, easy to understand source. When it comes to the emotional side of puberty, there was a couple books I wanted to mention too. One is called Untangled by Lisa D'Amour. This one's more for the parents, sort of like how to understand what your daughter is going through. But I know parents who've had their teenage girls read it too and had it be really helpful. And then the American Girl series does a good number of different topics, but they do also cover some of the emotional things with puberty, like friendship troubles, for example, because there's no shortage of those, gosh, difficult encounters as girls go through puberty. And this is a nice way to sort of think about it and give yourself some, kind of some tools on how to deal with those challenges as they come up. All right, so that takes us to the end of the talk, and then it looks like we have a good amount of time for some question and answer. So I hope you guys have some questions for us, and thank you for being here this evening. And I look forward to hearing your questions.
Great, thanks. So our first question here is a parent asking, will my daughter get her period at a young age like I did? Is that something that is genetic?
So it can be. Some girls will get their period around the same time their moms did, but for some, it seems like that particular aspect of their biological clock may be determined by the father's side. So you never know. The other thing is that in general, the onset of puberty for all girls seems to be getting younger and younger through the years, as I'm sure you've heard. And so it could be a little bit on the earlier side, but there's no way to know for sure. So the short answer is maybe. It's probably more likely than not that she will get it around the same time you did, but no way to be certain until she actually starts showing some signs of puberty.
Great, thank you. Our next question here is about recommendations for age and any type of deodorant that is generally recommended.
Yeah, absolutely. So good question. It's a little bit a little bit dependent on whether you kind of want to wait and see what happens. I think for many girls, we just end up starting deodorant when they start to have the more adult body odor, which often comes with the early signs of puberty. So around the time she's getting, breast bud development and starting to have pubic hair, she's probably also getting adult body odor. Now, some girls will actually get it before that. So really, as soon as she's starting to have that odor would be a time to start deodorant. And then I think, for many girls, if they haven't done that, around the time they go into middle school, that's kind of a nice natural transition time where you might want to go ahead and start doing it anyway. A lot of her friends will be doing it. So, I would say once she starts having adult body odor or middle school, kind of whichever comes first. And then as far as recommendations, I would start with something that is just a plain deodorant, not an antiperspirant. They're a little bit gentler, and most young girls don't need the antiperspirant effect quite as much. And so anything that you can find that's organic or, that sort of markets itself as being free of a lot of chemicals is going to be nicer, especially for the younger girls.
Great, thank you. Our next question is if you have a recommendation on what age parents should start talking about puberty and periods with their daughters.
Yeah, great question. So the first thing is if she asks, right? So any age is okay to have a very, very basic conversation if she asks about it, right? I mean, if she asks about it when she's 5 or 6, you could just keep it super simple, like, oh, puberty is when you start go from having a little girl's body to a grown-up woman's body, and she may just say, okay, and then run off. Um, More serious conversations about puberty and kind of making sure she knows what she needs to know, roughly around third or fourth grade is usually a good time for most girls, but of course it's going to be very individual to your daughter. A lot of the public schools start talking about puberty in fourth grade, so I definitely think it's good for girls to hear about it from their parents before they hear about it at school. Um, so you can find out what your particular school does, but I would say, anytime she asks, be ready to give a very, very basic explanation and then start to have the slightly more, detailed conversations. Third or fourth grade, you may not be ready for it then, but she will probably be hearing about it from friends and at school. We want her really first reliable source of information to be parents, right? And of course, you're always welcome to ask us, your doctors at Allegro, to talk about it with your daughter too. And we are more than happy to do that anytime. You come in for a checkup and want to start talking about it, we can help you with that too.
Great, thank you. Next question is what do I do if I get my period for the first time at school?
Yeah, good question. So hopefully you have your period pack with you that we talked about. and you have pads and tampons there. But one thing to note, you can always go to school nurse. School nurse is totally ready for these situations, and she can help you. If you don't have anything with you, she can help you. Um, but basically say you go to the restroom and there's blood and you need to deal with it, you can, it's good to kind of think ahead about like, okay, I need to clean myself up, right? And then get myself to the nurse if you don't have anything with you. So don't panic, right? There's people there that can help you. If for some reason the school nurse can't help you, if you have a female teacher, she can almost certainly help you. And there's your friends as well. But I would try, the school nurse if you don't have your period pack ready. If you do, take care of what you need to take care of. And then make sure to tell your mother at the end of the day, or your father, or your parent, or whomever you live with, so that they can help you from there.
Great, thank you. Let's see. So our next question is, will you continue to grow after you have your period, or does your growth stop?
Oh, yeah, great question. And I usually mention that, I forgot. Usually we grow for about 2 more years after we get our first period, on average about 2 more inches. So once you start getting your period, so the clock is kind of ticking on your height growth. So you've got a couple more years and maybe a couple more inches after your first period.
Great, thanks. Our next question is about swimming. So is it okay to swim when you have your period?
Oh yeah, good question. Now it's summertime. So swimming is tricky because if you have your period, absolutely you can swim, but your comfort swimming may depend on how comfortable you are using different period products. So, for example, it might be hard to swim if you're not comfortable using a tampon yet, right? So that's something that you can, that we often don't necessarily do right away with young girls when they're first getting their periods. So we often do pads first and then kind of move on to tampons with practice, which makes swimming easier. And then, of course, down the road, there are things like diva cups that you can use for swimming, but or in addition to all of the time. But there's no reason you can't swim necessarily. It's kind of just up to you and your level of comfort.
Great, thanks. I will also share here that I recently saw there is a new, they're like period underwear, but it's period swimwear.
Oh,
So
yes.
it's,
Thank you for
yeah,
reminding me.
kind
Yeah.
of absorbent, I guess, swimwear
Yeah.
for periods. So that's something to look into as well.
Yeah. That's very cool.